Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics so far discovered in a very systematic order. Definitely, it is quite convenient for the study. So, now talking about the significance of height velocity. What is the significance of height velocity? So it is quite simple to understand that before the height comes down, the weight velocity decreases. That is, before the height comes down, the height velocity reduces. There is a velocity every year, the height gain tendency. So that will going to reduce. Then only the height will come down, isn't it? So a single point measurement will not be going to tell you that how the child is going to grow. Does it is going to grow up or whether it is going to grow down. So this cannot be possible by measuring the height at a single point. Suppose a patient is coming to the OPD, you measure the height. The height is somewhere more than third percentile, and we can assure the patients that whether this child will going to grow well in future or whether it has grown well in previous years also. You cannot tell. For this you want a growth chart. So hence we have to plot the growth velocity chart from the beginning itself. From the day one itself, you have to maintain the growth velocity chart, which includes the height and weight, etc. both. So it is very important to detect the chronic disorders in the pre-symptomatic stage, and height velocity chart will going to help very much. Okay. In future coming chronic disorders, suppose the child is having some disease which is not showing all its features presently, but it is slowly developing inside the body. So it cannot be evidenced by the symptoms, and doctor is not able to catch it. But if you are able to maintain a growth chart and growth velocity, especially height velocity, is coming down drastically and it is not going up to the expected growth potential, then you can suspect that something bad is happening inside the body of the baby or child. Okay, that is the importance of growth velocity chart or height velocity chart. So many chronic disorders, it is very difficult to identify in the beginning. Okay, unless you have got a high index of suspicion, and we will miss many of the patients. So but this can be caught by the height velocity chart or growth velocity chart if you are maintaining from the day one. For example, a child with a celiac disease may not present with any of the GIT symptoms in the beginning, present just with a short stature or mild anemia, etc. But if you plot the height chart regularly in the growth chart, then you will see that height velocity is less. Then you start thinking why this height velocity is less. Then you can identify some of the causes. So you come to know that something chronic disease it is going inside. Now I need to identify that. So growth spurts are present. Okay, this is one important significance of the growth chart, especially height velocity chart. So today onwards you maintain the height velocity chart from the day one. Every time when patient comes to you, your clinic for one or the other reason, always measure the height and plot it in the growth chart. That is important. That gives the idea. One point measurement is not at all giving any idea. Okay, now importance of the phase growth. What do you mean by phasic growth? Growth spurts are present at 0 to 1 year. See, growth spurts, sudden growth increase, okay, height velocity or maybe weight velocity, whatever. So that will increase at a particular phase of the life. Every time it will not go increase. What are the different phases where actually the growth spurts are there? The timings of growth spurt, so that has to be handled very carefully. There should not be any nutritional problem in that particular period. Now growth spurts are present at 0 to 1 year. That means very rapid increase in the height, weight, etc. So that will take in between 0 to 1 year. That we know that. In the first year, the weight gain is about 6 to 7 kgs, excluding the birth weight. Only the gain is 6 to 7 kgs, and in the first year, the weight gain, height gain is around 24 centimeter. So this is a spurt. One spurt will be there at 0 to 1 year. Then second spurt is there at 5 to 6 years. 5 to 6 years means in the first standard, when the child is going to the first standard. So 5 to 6 years. Then another spurt will come at 9 to 10 years. 9 to 10 years. And the last spurt will come with the puberty. So you need to identify these are the 4 important growth spurt. In between child maintains the average growth. ठीक है, अगर कोई मदर आके बोल रहे कि 5 साल का बच्चा 8 साल का बच्चा है, इसको कुछ नहीं हो रहा है, सो वहाँ पे ग्रोथ स्पुट नहीं है. ठीक है, आपको क्या जो करना है ग्रोथ स्प्रुट में, ग्रोथ स्प्रुट अभी आने वाला है 10 साल 9 साल के बाद, तब वो बढ़ेगा. Okay, so this will be identified as a phasic growth in the height velocity chart. Okay, now in the height velocity chart when you're plotting, suddenly you have to see this particular point. What is 0 to 1 year, then 5 to 6 years, 9 to 10 years, then puberty. वहाँ पे growth कैसा था, वहाँ पे height बढ़ गया था क्या, तो वहाँ पे weight बढ़ गया था क्या. So that is very important. ठीक है, तो वहाँ पे भी नहीं बढ़ा, जहाँ पे growth spurt था वहाँ पे बढ़ना चाहिए था, और वहाँ पे भी नहीं बढ़ा. So definitely there is some problem is there. So this will be identified as phasic growth in the height velocity charts. There are different age in the child where there will be a sudden growth spurt that I have identified already. Isn't 0 to 1 year, then 5 to 6 years, 9 to 10 years, and puberty. Pubertal growth cannot be extrapolated from the reference growth velocities. Onset height velocity varies between sex and as well as individuals. Phase growth is just a pubertal growth. There is a phase where after the initial decline there will be a raise. This is different for each individual and as well as sex. Now here we are commenting on the pubertal growth. Pubertal growth में क्या है कि there is a difference according to the sex and as well as individuals. Okay, suppose genetic potential इतना ज़्यादा नहीं है तो even puberty में भी जो है आपका इतना ज़्यादा नहीं होगा. Okay, female मेल में जो है वो height velocity during the puberty, that difference is always there. Females are usually little shorter. So this phase growth is represented better in a height velocity curve. So always make the habit of measuring the height velocity and plotting the height velocity chart. So this is very important. Now come to the pubertal assessment. Pubertal assessment, once you are able to identify the pubertal phase in the height velocity chart, it helps to assess the two important problems in the children in the present day scenario. What is that? One is precocious puberty and another is delayed puberty. This is very common nowadays. Therefore, this is very important. Puberty में हमें जो देखना है, ठीक है, पहले 0 to 1 years हो गया, और उसके बाद 5 to 6 years हो गया, 9 to 10 years हो गया, then come to the puberty. Puberty में इसका growth कैसा था, ठीक है, तो ये बहुत इंपॉर्टेंट है क्योंकि आजकल दो प्रॉब्लम इज वेरी वेरी कॉमन. वन इज a precocious puberty and another one is a delayed puberty. Okay, what do you mean by precocious puberty? Precocious puberty means या तो आपका puberty जल्दी आ गया, okay, तो puberty जो है expected time से जल्दी आ गया, और puberty delay means expected time में भी नहीं आया. Precocious puberty is very common nowadays because of hypothyroidism. Because hypothyroidism is on the rise, and because of which the precocious puberty is there. So why this is happening? Hyperestrogenic conditions, hyperandrogenic state, any state where there is a hyperandrogenic state, hyperestrogenic conditions, hypothyroidism, etc., the precocious puberty is common. We will have the discussion in detail. Delayed puberty, that is common because of the constitutional delay in growth and puberty. Okay, delayed puberty क्या है कि constitutional delay हमें पता है कि 14 years तक जो है हाइट नहीं बढ़ रहा, उसके बाद सडनली बढ़ता है. कभी कभी उसमें भी थोड़ा लेट आ जाता है, एक्सटेंडेड प्यूबर्टी हम जो बोलते हैं. Okay, so that is also possible. Now, talking in detail about precocious puberty, this is very important. Now we take the example of hypothyroidism. Hypothyroidism is one of the most common cause for the precocious puberty, especially in female. Okay, any case of primary hypothyroidism will have the increased THS level in the blood. What actually happens that you have to identify. Okay, any case of primary hypothyroidism जब भी होता है तो TSH का लेवल बढ़ा हुआ है. Okay, now TSH contains alpha and beta chains, and these chains are very very similar to the chains of a follicular cell stimulating hormone and also luteinizing hormone. इसका जो स्ट्रक्चर्स है, TSH जो हार्मोन है उसका जो स्ट्रक्चर है, और follicular cell stimulating hormone और luteinizing hormone इसका जो स्ट्रक्चर है, they are almost all similar. They contains alpha and beta chains. Too much of TSH in the blood will go to the ovary. जब TSH का लेवल ब्लड में बहुत ज़्यादा है, then it will go into the ovary and it will stimulate the FSH and stimulate it like FSH. Now, too much of TSH is going towards the ovary because it is there in the blood. Okay, और उसका स्ट्रक्चर और आपका FSH का स्ट्रक्चर एक ही जैसा है, तो ओवरी को क्या कन्फ्यूजन हो जाएगा, ओवरी थिंक दैट दिस इज FSH ओनली. ठीक है, तो TSH को वो FSH समझ के बैठेगा, एंड एज अ रिजल्ट नाउ ओवरी स्टार्ट रेस्पॉन्डिंग फॉर दैट, ओवरीज गेट स्टिमुलेटेड. सो ओवरी विल प्रोड्यूस एक्स्ट्रा ईस्ट्रोजन्स. FSH आया ही नहीं है, TSH की वजह से ओवरी नाउ स्टार्ट प्रोड्यूसिंग एक्स्ट्रा ईस्ट्रोजन्स. Same hypothyroidism, if it occurs in the males, it will go into stimulate the androgens. Going to stimulate the androgens. Female may estrogens. Okay. Now, or this is one possibility. So now what happens? Ovarian growth will take place. Okay. We have got menarche earlier. We have got menarche earlier. Once the menarche occur, then the growth, the spurt fall down. Okay. I will explain why it is. So similarly, males में अगर hypothyroidism हो गया तो एंड्रोजेनिक हार्मोन्स ज़्यादा प्रोड्यूस हो सकता है, सेम स्टिमुलेशन हो जाएगा वहाँ पे भी. सो नाउ दिस लीड्स टू द पेरिफेरल प्रिकॉशियस प्यूबर्टी. सेंट्रल प्रिकॉशियस प्यूबर्टी अलग है, पेरिफेरल प्रिकॉशियस प्यूबर्टी अलग है. दैट इज अ सेपरेट क्लास, वी विल सी समवेयर. ओके, सो दिस लीड्स टू पेरिफेरल. ओवरी is situated in the periphery, not in the this is problem is because of the ovary, not because of the TSH from the brain, pituitary gland. So therefore it is called as peripheral precocious puberty. So this is the cause why actually in case of hypothyroidism we will have precocious puberty. TSH जो hormone है, that will act like a FSH hormone, and now ovary is confused, it start producing the estrogens and there is a puberty. Precocious, early puberty will be there. Now importance of growth velocity chart in the precocious puberty. Now these children initially show the growth spurt, but these hormones will also accelerate the epiphyseal closure. This is the main problem. ये जो hormones हैं, estrogen etc. So they will accelerate the epiphyseal closure. जो आपका क्या बोलते हैं उसको, the centers, ossification centers which are present in the bone. So they will be closed earlier. Epiphyseal closure हो जाता है. So एक बार epiphyseal closure जल्दी हो जाता है, so bone का growth नहीं होगा, length नहीं बढ़ेगा. So these hormones which are produced after menarche like estrogen etc. So they will grow into close the epiphyseal closure. So this end up in a short stature or decrease the height velocity, although they start with a good height. So they start with a very good height. 9th 10th year तक उसका height बहुत अच्छा था, but उसके बाद जो है precocious puberty में आ गया वो, और उसके बाद उसका height कम हो गया. जैसा precocious puberty में आ गया, menarche जल्दी हो गया. So in a hypothyroid child, the bone age will be delayed even if the child is with the precocious puberty. Okay, another important thing, bone age अभी तक हमने बात ही नहीं की है उसको, that will talk in detail. In a hypothyroid child, the bone age will be delayed even if the child is with the precocious puberty. Bone age is delayed. Bone age इतना बड़ा ही नहीं है, but उसका तो ये तो हो गया. For the puberty to happen, जैसा फीमेल में हम बात करेंगे, the puberty to happen, there should be telarche, there should be increase in the testicular volume up to 4 ml in puberty. There is a need to be certain bone age. There is a need to be certain bone age. So bone age and Tanner's sexual maturity rates will go hand by hand. That we will discuss in detail. Okay. Only after attaining the certain bone age, there will be the onset of puberty. अब precocious puberty में क्या होगा? Bone age delayed है, but puberty तो आ गया. बोलने का मतलब ये है कि ये bone age में जो increase होता है, ठीक है, और प्यूबर्टी जो होता है, ये दोनों साथ हाथ मिलाकर जाना चाहिए. बट जब प्रिकॉशियस प्यूबर्टी वाला बात आ जाता है तब बोन एज वहीं पे चला जाता है, रुक जाता है, और प्यूबर्टी तो आगे बढ़ता है, तो ये मिसमैच हो जाता है एंड चाइल्ड डेवलप द शॉर्ट स्टेचर. सो बोन एज एंड प्यूबर्टी विल ऑलवेज गो हैंड बाई हैंड. सो डिलेड प्यूबर्टी इज नथिंग बट कॉन्स्टिट्यूशनल डिले इन द ग्रोथ एंड प्यूबर्टी. सो दैट वी विल डिस्कस लेटर. So this is very important, some of the important aspects about precocious puberty. The next class onwards we will see there are so many ages. What do you mean by chronological age? What do you mean by height age? What do you mean by weight age? What is mean by bone age? Okay, so that we will see in the next class. Thank you very much.